Yes. Yes, here it's just one slide though, but you can take as long as you need.
Okay, I'm ready.
Both are ready? Yes,
Yes, I'm ready.
Okay, so if you've read and understood, considering it communication skill station, please begin.
Okay. Hello, my name is Ofyong. One of the surgical doctors working for Dr. Man. I'm calling to speak with the on-call consultant to seek his advice concerning a post-operative patient who had a laparoscopic right hemicolectomy for a cecal tumor. Can I confirm I'm speaking with the on-call consultant, please?
Yes. Please, could you tell me about your name of your consultant again?
Mr. Man.
Okay. Summarize your case, please.
Okay. The patient is a 69-year-old lady who had an elective right hemicolectomy for a cecal tumor alongside with a liver biopsy about 24 hours ago. Currently, urine output is 10 to 20 mils in the last 8 hours, and I've checked the urinary catheter and it's not blocked. Clinically, the patient is tachycardic, she's hypotensive, and the available laboratory investigation showed that her hemoglobin levels dropped from 12 to 10, and she had received 2 units of blood intraoperatively. Also, lab finding shows that her creatinine levels and urea is high, and she has received 1,100 mils of normal saline in the last 24 hours.
Okay. So, what do you think the cause is?
Okay, I think the patient is dehydrated because she has received just 1,100 mils of normal saline in the last 24 hours.
Okay. And why creatinine is high?
Because she's dehydrated.
Okay. And what is your plan of action?
Okay, initially I'll do a fluid challenge with 250 to 300 mils of Ringer's lactate over 15 to 30 minutes, and then I'll reassess her for a response to the fluid challenge, and then I can repeat the fluid challenge up to 4 times and continue monitoring for her response. And then if she fails to respond overnight, then I'll call the ITU registrar and the ITU consultant and inform them. And I'll also pass a central line to continue monitoring the patient. Then I'll repeat the blood work to ascertain if there's still a drop in the hemoglobin levels. And if it's still dropping, then I'll commence transfusion.
Okay. So, how you monitor his response to the fluid?
Okay, by closely looking out for the vital signs, the pulse rate, blood pressure, and the level of consciousness, and also the capillary fill, and the urine output also.
Okay, fine. Do you think the patient is have any bleeding?
No, I don't think the patient has bleeding, but however, I'll continue serial abdominal examinations to look out for any signs of bleeding, and if I find any sign, I will let you know.
Okay, that's fine. Do you think that it is an anastomotic leak?
Okay, well, I don't think so because currently the patient is not toxic and there are no abdominal signs currently. There are no signs of peritonism. However, I'll continue close and serial abdominal examinations and possibly an ultrasound scan of the abdomen. And if I find any sign, any abdominal sign, I'll let you know.
All right, that's fine. So, do you need me to come back?
No. I'll start the fluid challenge and I'll update you on the response.
Okay. So, does he require HDU transfer?
She may require a HDU transfer. However, that will be only if she does not respond to the fluid challenge up to 4 times.
Okay. And also, does she require operation now?
She may require an operation, but again, I'll need to continue with the fluid challenge and also monitor her hemoglobin levels. And if there is a need for that, then I'll let you know too.
Okay. If HDU is full, how are you going to speak to him?
Okay, I'll speak to the HDU registrar and consultant if she's not responding to challenge.
Okay, and what are you asking for?
Okay, I'll be asking for a space so that the patient can be closely monitored.
Okay. Do you think the patient is shocked?
Yes, yes, because the patient is dehydrated and hypotensive.
Okay. What do you do for fluid challenge him? What is the dose exactly?
Okay, 20 mils per kg
Okay.
per day.
Okay. So summarize your case.
Okay, in summary, she's a 69-year-old lady who had an elective right hemicolectomy for a cecal tumor with a liver biopsy 24 hours ago. And her urine output currently is 10 to 20 mils per hour in the last 8 hours. Clinically, she's hypotensive, tachycardic, and a lab investigation shows that urea and creatinine is elevated and abdomen is soft and has received just 1,100 mils of normal saline in the last 24 hours.
Okay.
Thank you.
Okay, thank you.
All right. Can you tell me if your patient drops saturation immediately, what would you do?
Okay, if the levels of saturation drops, I'll call for help, and then I will manage the patient as an acutely ill patient using the C-CRIPS protocol, using the ABCD approach, where I'll access for and maintain the airway, and then I'll access for breathing, and I'll commence oxygen via rebreathable oxygen mask at 10 liters per minute, and I'll continue repeat and serial SpO2 monitoring, and then I'll set 2 white ball cannulas and then collect samples for full blood count ABG, and
And the
I'll
most
start
important
fluid and chest X-ray,
and
CTPA,
yes, and
CTPA, and arterial blood gas.
you'll give
Oh,
anticoagulant, Lexine, and you'll have TED stocking
that's talking. Yes,
to begin
thank
with. What would happen to the patient? Why would a patient have sudden drop in saturation?
Okay, top of my differentials will be pulmonary
embolism.
embolism.
Because yes,
He had a
yeah,
pelvic surgery
and
and
patient is lying down. Okay, what are different types of shocks this patient is or this patient might be going through?
okay, hypovolemic shock,
One, yes, and
septic shock, maybe because of anastomotic leak.
all right. Though, sorry, here, no, not because of anastomotic leak. Septic shock occurs only when there is raise in temperature. So here,
Okay.
though there is tachycardia means maybe there is ongoing bleeding somewhere. That's why patient is having persistent tachycardia. Otherwise, temperature is almost normal. If it was more than 38, then you would have said that, okay, now patient is in septic situation, so there is septic shock. But there is ongoing bleeding. That's why there is persistent tachycardia, but there is no septic shock. So
Okay.
hemorrhagic shock, yes. That is, yes, definitely. All right, good. Thank you so much.
Thank you. Thank you.